All right, ladies and gentlemen, it is Mr. G here, and we are winding down this course. We are getting to the end of it and with our last couple of chapters here. This one is on older adults, a population that we as Floridians, or I guess if some of you are in Georgia, wherever you're from, we are in primarily located here in Florida, Sunshine State. We got lots of sunshine and we got lots of older adults. These are people you will undoubtedly encounter in your work in the field. So it is important to talk about them and keep in mind some of the considerations specific to this group. And that's what this chapter is going to be all about. It really does go back and kind of hit on a lot of the other conditions we've already covered so far as part of this course, but it kind of puts it all together into this population specifically and gives you a few more recommendations and considerations based on their age and some other common characteristics that are true of a lot of older adults. So without any further ado, let's hear it. All right, so we're going to talk a little bit about the aging process and what happens as we get older. You already know about skeletal muscle, what it does. It's an important role in movement, independence, weight maintenance, and overall health. So having muscles, right, having lean tissue on the body is important. After the age of 30, muscle mass begins to decline without exercise. So you start to lose it, which can lead to a lot of really negative implications for health and quality of life as we progress through the rest of our lives. For those who don't perform resistance training, muscle tissue is lost at a rate of about 3 to 8% every decade, decreasing by 5 to 10% each decade after the age of 50, and then even more rapidly after the age of 60. So when it comes to muscle mass, if you don't use it, you do lose it. That is absolutely true when it comes to skeletal muscle. Now, you've heard the term atrophy, and you know that versus hypertrophy, which is muscle mass shrinking. Well, this decline of muscle mass with age, again specifically age-related muscular system decline, that is called sarcopenia. Okay, sarcopenia is like atrophy, but this is specifically tied to age. So the decline in muscle with age, sarcopenia. That is a good term. You may have heard it before. You will undoubtedly hear it again. That is what it means. We know that having more muscle on the body means that actually drives up our metabolism. Muscle mass is very metabolically active, and muscle loss then results in a decline in our resting metabolism, which can then, so if we're not burning as many calories, we're not burning as much energy, that can have a negative effect in the opposite direction, and we can actually increase body weight, and we can even contribute to other metabolic diseases, which are some of the things we talked about much earlier in this course. Now, in particular, increases in intra-abdominal fat are related to metabolic and cardiovascular disease, right? That's not like the subcutaneous fat. That's that visceral fat located right in the midsection. We know that having more of that actually contributes, or it is an indicator that you are at higher risk for other disease. Muscle tissue is largely responsible for glucose metabolism and triglyceride disposal. So it really pays to make sure that you stay active and really continue training your muscular system throughout life, because if you don't, not only do you just lose muscle mass, but it can actually affect your metabolism and lead to more metabolic disease and more fat mass, and that's going to lead to a whole slew of problems and really is an underlying cause of a lot of the issues we have already covered as part of this entire course on special populations. In addition to in addition to the muscular system health, sarcopenia is also related to osteopenia, or an age-related loss of bone tissue, which that affects up to 35 million American adults. Remember, osteopenia is like a precursor to osteoporosis. That is a critical loss of bone mass, where now your bones become very brittle and likely to break. But osteopenia, which is your bone mass decreasing naturally with age, and that gets subclinical levels, but it's an indicator that, hey, we maybe should be a little bit more protective of this bone health. Well, losing that muscle mass, because remember, in addition to weight-bearing activity when it comes to bone health, it's also recommended that strength training get done as well, because that helps to maintain bone mass. So if you're losing muscle mass, you're going to lose bone mass too. So where muscle mass may decrease as much as 10% each decade, bone mass can decrease as much as 30% each decade, a range of 1 to 3% reduction in bone mineral density each year. Now that's going to be dependent on a number of other factors, including things like we've talked about when it comes to bone health, men versus women and all that, but that's a pretty pronounced drop-off. And these two things, just like the rest of our body, our systems are all connected and interrelated with one another. Sticking with things here in the muscular system still, type 2 are your fast twitch muscle fibers. These are also lost at a greater rate, so more quickly, than type 1 muscle fibers, resulting in a loss of muscle power that declines at a faster rate than muscle strength with age. So power is faster to go than strength when it comes to the aging process. And muscle endurance, which is much more closely associated with type 1 than type 2 muscle fibers, that decreases at a slower rate than muscle strength. So power, strength, then endurance. That's the order in which they will decline, at least in terms of the rapid rate of them declining. But still, we're going to talk more, of course, about what happens when you do exercise and how we can help to maybe mitigate this issue, to make it not quite as bad, slow it down, or in some cases, reverse it entirely. So that's a lot with strength training, what happens if we don't exercise with aging. How about the cardiorespiratory system? Age also affects our cardiorespiratory system, including your maximal stroke volume, your heart rate changes, your cardiac output will decrease progressively. All of these happen as part of us going through the natural processes of life and aging. Increases in ventricular wall thickness and stiffness of arterial walls and lung tissue. That thickening can help to contribute to an overall decline in aerobic capacity. Dyslipidemia, hypertension, these are also more common in older individuals. But exercise intervention can actually help with some of these negative changes. From a brain and nervous system standpoint, there is a significant effect here, including on all of our sensory systems. When it comes to brain and mood, aging leads to a more negative physical self-concept. People don't think of themselves as highly from a physical standpoint as they get older. There are general mood disturbances. Depression is common with aging. High tension and high anxiety and reduced cognitive ability. So even your thinking gets affected as you get older. In addition to that, your sensory issues, your sensory input is affected. Motor skills, performance of physical tasks, that starts to decline. Your vision, you'll have less accurate visual information when it comes to hand-eye coordination or eye-limb coordination. Hearing loss is a big component. Desensitization of muscle sensory systems like the Golgi tendon organ and muscle spindles. So, I mean, everything with aging, it just starts to slow you down. I know that sounds really depressing, but this is what science has shown us. As we get older, we start to break down. What do they do to fix it? Well, they give a lot of medications. I mean, it's impossible to start giving you a list of medications because most medications are given for all of the diseases and conditions and disorders that are in this text, right? It's usually because of side effects or other diseases that someone might have. But keep in mind this statistic right here. This is the most jarring one, I think, in this whole summary of what it is when it comes to talking about older adults. And that's the fact that people between the ages of 62 years old and 85 years old, 87% of them take at least one prescription medication, and often more than one physician is going to be prescribing the medication. So they're taking more and more meds from more and more doctors, and that is troublesome, and that is how we have kind of adapted to treating most diseases and disorders. So as a health and fitness professional, That's why we have them fill out those forms before they get started, and why we have them updated hopefully annually, because we want to know about what medications they're taking. Not only are they things that we need to be concerned with sometimes in terms of their effect on the exercises we might have someone do, but we also want to see, especially because they're getting them from different doctors and they might not all be talking with each other, there might be some harmful drug interactions. So this is something that affects not just nurses and physical therapists and other kinds of doctors, but this is something that might impact you as someone working with this individual. So having that knowledge, having that up-to-date information and looking at it and comparing the two, that's going to be important for you as well. So do a little bit of homework there when it comes to what medication someone is taking. If they ever come to you, that's why you have this text. That's why there's lots of other great resources. You go in, you thumb through it, you find it, and you make sure that you take all of that information into consideration before you develop a program for someone. We know, again, that they take so many meds. Very commonly, they'll be given medications that slow the heart rate. So we might need something from a doctor saying how intense an exercise should be. Again, keep that list of medications and review it constantly. Look at this text, look at other resources to help make the best decisions in terms of programming. Now the good stuff, okay? It's a lot of gloom and doom. Aging is not necessarily a bad thing. It is a part of life. It is a very natural process that occurs. That being said, if left to its own devices, yes, there are some negative changes in the body that can happen. However, that's where we come in. If you're an aspiring health and fitness professional, and so this is where we find out exactly what it is that we can do, what exercise can do to help with the aging process. So we're going to start with aerobic capacity here. When someone does aerobic endurance training, generally speaking, there is an increase in their aerobic capacity. This is in part because of the pumping capacity of the heart is going to improve. Other improvements, however, are going to be a lower resting heart rate, so the heart's not working quite as hard while they're resting, and a lower resting blood pressure. These are good things because these are correlated with other more serious diseases, so we can have a positive effect on the heart. How about muscle mass? We talked about that. That's how we opened in terms of what the aging process does. Muscle mass and metabolism. Well, research actually shows that relatively little resistance training, so just 2 to 3 days a week, can help to increase muscle mass even in older adults by an average of about 3 pounds. There's also evidence that resistance training that causes microtrauma requires an increase in metabolic rate by about 5 to 9%, then lasts 72 hours after the workout. So after exercising, particularly with a strength training program, the metabolic demand is going to be higher for up to 3 days later. Their body's going to be working harder and burning more calories. So that's going to be something that's good from a metabolic standpoint, not to mention you're building their muscle mass, which has a number of different benefits. Especially if you do it more regularly. So they say chronic resistance training. That almost sounds bad because we usually say chronic exercise, but more consistent resistance training. That has an effect through muscle hypertrophy. Yes, you can actually help to build more muscle mass, make those muscles bigger. That can actually happen within a 6 to 8 training protocol, 6 to 8 week training program. Every additional pound of added muscle requires an additional 9 calories per day for maintenance. So that's a higher metabolic rate that's going to be there. Over time, that can actually help with quite a bit of weight loss. And of additional muscle would result in 40. So if you had 5 extra pounds of muscle, that's 45 extra calories a day. Theoretically, that translates into nearly 5 pounds of fat loss over the course of a year. Might not sound like a lot, but as opposed to maybe gaining 5 pounds every year as part of the aging process, losing 5 pounds, yeah, I'd say that's a good thing. So this is a great benefit of that muscle strengthening program for someone that's getting older. And of course, don't talk about these things necessarily in isolation from one another. They should go together. So when you put resistance training and aerobic exercise together, that results in a substantial acute increase in metabolic rate. So that's how many calories we burn, and that will contribute to overall weight maintenance or fat loss over time. Even with diseases like type 2 diabetes. We know that aerobic exercise is great for maintaining body fat, but it also can help with controlling glucose levels, right? Regulating the body's blood sugar. Resistance training may be as effective because of its ability to improve insulin resistance and glycemic control. So not only is aerobic exercise something that's beneficial with type 2 diabetes, but resistance training is too. So these are things that someone with diabetes as an older adult, and really anywhere for that matter, should incorporate because it can actually help to improve their quality of life and of course increase muscle mass, etc., so on and so forth. When putting all of it together, you get better resting blood pressure. That will actually come down, so that's healthier. Resistance training, when performed alone and in conjunction with aerobic exercise, can reduce systolic blood pressure between 3.2 and 6 millimeters of mercury, and your diastolic blood pressure between 1.4 and 4.7 millimeters of mercury. So the high and the low numbers there kind of represent working either together or separately, but that's a substantial decrease. And since so many people take blood pressure medications, being able to naturally take those numbers down to a point where maybe someone no longer needs medication, that's going to have a lot of tremendous benefits for their health. When it comes to blood lipids, hold on guys, sorry. Computer's giving me a little notification here. When it comes to blood lipids, studies of aerobic and resistance training show lower total cholesterol and a lower LDL, right? Keep the low low, keep the high high. That's what we want when it comes to cholesterol. Lower total cholesterol, lower LDL cholesterol levels, lower triglycerides, and higher HDL. So just overall a better blood lipid profile just from having aerobic and resistance training in someone's life. Putting them together is going to yield the best results, but you do get benefits from doing one or the other. General cardiovascular health is also improved with research showing resistance training on its own can be nearly as effective as aerobic training. But again, why operate in isolation if you don't have to? Make all of it part of the new lifestyle changes to help with the benefits. And we kind of hinted at it earlier as we were talking about reversing the decline in muscle mass, but bone mineral density. Resistance training has generally been shown to improve bone mineral density over time and may actually be very effective in certain populations. So the example they give here is possibly a 1 to 3% increase in bone mineral density in postmenopausal women over the course of 2 years. Remember that women, older women, as after they go through menopause, they see a significant decline in their bone mineral density. Significant. They are the most at-risk population there is when it comes to this sort of thing. So the fact that we can actually turn that around and increase it through resistance training, that just tells you how much of a benefit this strength training can be for that issue alone. And at the end of the day, when it comes down to why we do any of this, especially for older adults, it's all about being able to live your life independently, being able to still do things on your own. And that resistance training that gets done, that helps them increase their strength, lean mass, and scores on a functional independence measure. So those tests that are designed to just see how well they can function around the house, those go up too because of it. The result is an improvement in movement control and walking speed too. So then we can burn more calories. We don't have as much fat. We have a higher metabolism. You see how this all works? It all goes together to help improve the quality of life of this person so they're not just wasting away anymore. That's all the physical stuff. There's also the mental stuff too. Benefits of participating in resistance training by older individuals also extend to mental health. These include improvements in self-esteem, cognitive ability, so they actually are able to still think more effectively, less fatigue, they're not as tired all the time, less anxiety, less depression. When you put resistance and aerobic training together, that can see better improvements in self-concept, mood, positive engagement with other people, revitalization, so feeling reinvigorated, a new sense of energy, a new lease on life, and more peace, less depression, less tiredness, fatigue, and less tension, so stress comes down. So many benefits of exercise. So what do we tell them? How do we give them? The table's on page 394 of the text. The recommendations are simple. Again, you're going to choose exercises. You're going to create this program based on what problems your person has, what problems your client presents with, what diseases, what conditions. That's going to dictate to you what you should do. In general, older adults, resistance training, 2 to 3 non-consecutive days each week. That's very similar to the general population. When they're starting out, 1 set is good. It should be enough. But multiple sets are going to have better results over time. So if they're just starting out, if they don't have prior experience in resistance exercise, maybe you start with 10 to 15 reps at 40 to 60% of 1 rep max, and then progress to that 8 to 12 reps, 70 to 80% 1 rep max, and maybe you can pepper in some additional sets so that you can have more benefits. But take it slow, be progressive over time. Speed should be controlled. Strength training should precede any kind of power training that you might do. For those older adults that might be participating in power training, exercising involving medicine balls are great for reducing joint stress while training for higher speed movements. So that's a modality that is highly recommended. All exercises should be through the full range of motion. Right? There's not a lot in here about flexibility, but flexibility is super important when it comes to older adults. So make sure any exercises you do utilize a full range of motion. Don't use a Valsalva maneuver. That can help to screw up a lot of things. It can impede venous return, produce dizziness, blackouts, heart ischemia. We don't want any of that, so don't use it. From an aerobic standpoint, 5 or more days a week, 150 to 300 minutes of moderate intensity, or 75 to 150 of vigorous intensity. So you see those numbers? The low end is your general population amount. The high end is double that. So get them moving, get them active. Moderate exercise should elicit an RPE of a 5 or 6 on the 10-point scale. Vigorous is a 7 or 8. Again, always go back to those scales, whether you're using a Borg scale or a modified scale for guidelines, but right smack in the middle is where they're looking for moderate versus vigorous. And any exercise choices that you do should be large muscle, rhythmic, weight-bearing activities. So we're saying not so much a pool unless they have other activity or other conditions that might make that a better choice for them, like osteoporosis, something like that, or osteoarthritis. But walking, biking, ellipticals, running, if that's something that's an option for them. There are plenty of folks that are older that do run. It's not something you're going to recommend to everyone, but these are all different examples of large muscle, rhythmic, weight-bearing activities. Pretty much any of those cardio machines, anything that's really weight-bearing, that's going to be key and critical to helping as well. And then when it comes to working with people, yes, every individual is different and you should treat someone based on their own individual merits. But speaking kind of generally here, it can be challenging to motivate older adults. And studies show that less than 5% of adults over 50 years old regularly engage in moderate intensity exercise. So if you get somebody, you're already working an uphill battle because very few people even bother with it. They might have some concerns about their joints or their muscles or a heart problem. Here's what you do, a couple of suggestions. First of all, explain the physiological benefits. If you can't remember what they are, well, you can always go back through this little handy-dandy presentation that's here provided by Mr. G over at KU. You can also go to your book, and a lot of these are pretty well known, but some of these folks need a little more reassurance. Also, use specific interactive training strategies geared toward this population. So use things that actually make sense for older adults. Don't use the same approach when it comes to equipment, music, or anything when you're working with this group. Some other strategies here. We'll go through them as we wind this topic down. They should be given understandable performance objectives, concise instructions with precise demonstration. So keep it short, sweet, and simple. And when you demonstrate it, make sure that it is accurate, right? Your instruction should always be coupled with demonstration, as older adults tend to be visual learners. They need to see it, and then you need to make sure that your description is concise, short, to the point. Usually the opposite of how I describe pretty much anything. Attentive supervision. Always, always, always be watching an older adult perform a new exercise. That'll help them enhance their confidence and your confidence in them, of course. But it also gives you as an exercise professional the ability to immediately see if there are any errors or anything that requires correction when it comes to how they're performing this exercise. So you want to be able to give that feedback immediately. Assistance. So guiding an older adult through the proper movement pattern may be particularly useful when training with elastic bands and free weights. So giving them a little extra help. Only give them one thing at a time. Older adults typically master exercise performance more efficiently when you give exercise components one at a time. Don't overburden somebody and give them a million things they have to do back to back. Short, sweet, one at a time. Let them only focus on the task in front of them, and then introduce the next task once it's been completed. Progression, much like anything, but especially with older adults, very gradual. A couple basic exercises, then over time as they begin to master them, get better, you start to add new exercises. Always, always, always provide positive reinforcement. Older adults typically experience some degree of uncertainty about performing resistance training. They might be scared. We kind of mentioned that at the beginning of this section when it comes to strategies. Everyone wants to feel good about what they did, so positive reinforcement is crucial. Regular encouragement really can help to improve their experience and help them overall in their compliance, their life, and even in your session and relationship with them. Give specific feedback, right? You want positive reinforcement and very specific feedback. That's got a value from a motivational and an educational perspective. So combining those two things. They still want to learn. And then careful questioning. Here's the thing. Older people are old school, and they may not complain. They might not tell you about something voluntarily. They're not going to just put stuff out there, maybe like someone much younger would. So you're going to want to make sure you really probe carefully about how they're feeling when engaging in resistance training, because they'll probably just suck it up and do it regardless of how it feels, and then they won't have a good time, and that might affect them negatively later. So use non-visual cues. Watch their body language, their eyes, their effort. They might not always speak with their mouths to tell you what's going on. So make sure you carefully consider what's happening during your session with your clients. And finally, ladies and gentlemen, when working with older adults, you want to have a brief dialogue with them before and after. A lot of this, for older adults in particular, if you've ever worked around them, I haven't worked with the population specifically, but I have worked with enough of them to know that this is true. They appreciate the social element when it comes to exercise. And I've observed enough classes or worked at places with enough people in this population to say that that is 100% true. It's all about that rapport building, about caring about each other as people, you as a trainer, them as a client. So have that dialogue. Talk with them before and after the exercise session. Again, you might talk about things off topic, but when it comes to talking about things on topic, emphasize encouragement for attaining their workout objectives, and the exit conversation may feature reinforcement for their exercise performance. So really compliment them, let them know how they did, give them that feedback, send them on their way. Don't just rush off to the next client. You really want to take your time to have and incorporate that social element both before and after your exercise program with them. Hope you guys enjoyed listening to this regarding older adults. Again, we are winding it down here in the exercise programming for special populations class. This is Mr. G signing off. We will see you on the next one.